So your dentist tells you you've got a cavity, you've got gum disease, you need a deep cleaning, you need treatment. And what are you thinking? Oh, I bet if I just oil pull, that's going to fix my problem. It's going to make up for all the bad oral hygiene habits, my poor brushing and flossing, the fact that I've got tartar all over my teeth and under my gums, and I've got a hole in my tooth. If I just oil pull, surely that is the magic solution. Well, I'm Dr. Rachel Hall. I'm a holistic dentist, and I'm going to answer that question, and I'm going to expose that myth. Is oil pulling actually worth it, and will it make a difference to your oral health? Well, the answer to that is it depends. If you've already got gum disease and you've got problems, oil pulling is not going to fix that without it being treated. The same if you've got a cavity. It needs to have the decay removed, the rotten part of the tooth replaced, and a filling put in. But oil pulling can be a very valuable part of your oral health routine, and it can prevent you having problems. So let's have a look in a bit more detail about what oil pulling is, how you do it, why you do it, what the science says, and if it really works. Well, coconut oil pulling is an ancient Ayurvedic practice. It involves using about a tablespoon of coconut oil, and then you get that melted and you swoosh it around your mouth for about 10 to 20 minutes. Now, people claim it can improve your oral health, it can whiten your teeth, and that it can even detoxify your body and prevent you having health issues. Well, I'm not so sure about all that. Seems to be a lot of claims and not a lot of science. Coconut oil's got antimicrobial properties. That means it stops bacteria. It contains a thing called lauric acid, and that's shown to kill harmful bacteria in the mouth, including the one called Streptococcus mutans, which is a major cause of tooth decay. Coconut oil is anti-inflammatory, so it can reduce inflammation. That can help reduce gum disease and gum inflammation and gingivitis. It can improve your oral health. Studies have shown that oil pulling can reduce plaque and tartar buildup, and therefore gingivitis and tooth decay. So how do you do it? Well, first of all, you need to choose your oil. Now, traditionally it used to be things like sesame oil. Now it's more coconut oil, but you want a good quality coconut oil. Buy the best you can afford, get an organic one if you can. Then what you want to do is make sure the oil's slightly warm, otherwise it's going to be really thick, and you want it to be liquid so that you can get it in your mouth. Then you get a tablespoon of the oil and you swish it around your mouth. Now, it's not just a little, very casual. It's pulling. So you're meant to actually draw with a lot of force that liquid oil backwards and forwards across your teeth and gums, from the front to the back of your mouth and across the side. So it's more a like really good Maggie Simpson on her dummy in The Simpsons, that sort of dummy sucking kind of force. You can then gargle it, but I don't advise that because you can end up inhaling it and you can get respiratory lipidosis, which is getting oil drops into your lungs, and that can cause an infection, and that's not a good thing to do. So once you've done your 10 to 20 minutes. Now I'm going to come back to that length of time for you. You then spit the oil out. Now don't spit it down the sink because it's going to harden and it's going to clog up your pipes. So you want to spit it like into some tissue and then throw it in the bin, and that way you're not going to have problems with your plumbing. Then afterwards, you need to rinse your mouth with warm water, and then you need to brush your teeth as usual and clean in between the teeth with either floss or the little interdental proxy brushes. Now, your benefits: you're going to get improved oral health. Absolutely. You're going to reduce plaque. You're going to reduce your risk of gingivitis, which is gum disease. You're going to reduce bad breath as well. You will, to a certain extent, look, and I don't think it's a massive change. You're going to get some gentle whitening of your teeth because you're going to be replenishing the minerals into your tooth enamel. You're going to reduce inflammation, so it may help with gum disease and other oral issues. Now, the potential detoxification, there are some claims that it can help detox the body, but really there isn't any science on that, and more research is going to be needed. Now, I touched on this briefly earlier with the lipidosis, the risks are it is a choking hazard. You've got to be really careful not to sort of inhale the oil. Good not to swallow it either, and especially if it's a child doing it, you need to really supervise them quite closely. You can get disrupted oral flora. You can mess up your oral microbiome because while it kills the harmful bacteria, it will also kill beneficial bacteria, and it's time consuming. 10 to 20 minutes. I mean, I know I get people say, oh, I do it while I'm in the shower and I'm getting ready for work and what have you, but really, does it need to be that long? Well, my answer to that is I don't think it does. I think maybe 2 to 3 minutes, like you would with a traditional mouthwash, is sufficient. Longer than that, and you are risking killing off your good, harmless bacteria that help protect you from pathogens and disease. It is not a substitute for dental care. Oil pulling is not going to replace regular brushing and flossing, dental checkups and professional cleanings. I think coconut oil will offer some benefits for your oral health, but it's not a miracle. It's not going to correct your gum disease, your periodontal issues and your tooth decay if you already have them. It's an adjunct to help re-heal your mouth and then keep it healthy, or to prevent you having problems in the first place. Now, why would you do oil pulling instead of mouthwash? Well, it comes down to preference. A lot of mouthwashes, unless you get a natural one, they contain alcohol, they contain a lot of chemicals, they contain products that also can reduce your nitric oxide production, and you need that to stabilize your blood pressure and remain healthy. So they've both got their benefits. It's what you want to do or don't do. So if you look at the pros and cons, oil pulling, it's natural, it's chemical free, it will kill harmful bacteria, it may reduce plaque and gingivitis, it's going to help with bad breath, it's time consuming, it may disrupt your beneficial bacteria, and it is not a substitute for brushing and flossing. No, let's have a look at mouthwash. We've got to be fair, put both sides of the argument forward. It kills bacteria, reduces plaque. It can freshen your breath, can prevent gum disease. Benefits, it's quick and easy to use. It can contain alcohol or harsh chemicals. Some of those can stain your teeth, and also, like coconut oil pulling, it can disrupt the natural balance of your oral bacteria. So which is better? You know, should you oil pull or should you use mouthwash? Well, really, they're not the be all and the end all. They're an addition. So if you've got good brushing and flossing and you're getting regular dental care, these are the most important things, as is not having too much sugar, having a good diet, getting all the nutrients that you need, sleeping well, being hydrated, low stress, all the things that help your body stay healthy. They're far more beneficial to you, not smoking. Oil pulling or mouthwash are a supplement. They're a little add-on that you can do just to make things, even better. So if you want to oil pull, then that actually comes down to personal preference. I'm not for it and I'm not against it either. If my patients want to do it, then I just explain to them exactly as I've done today, not to overdo it, be aware of the potential pitfalls, and don't spit it in the sink. Now, if you want to know more about how you can have really good oral health and prevent yourself from having gum disease and tooth decay, then check out this video over here.